Professor Joseph Beebeejaun, Clinical Research Fellow, King's King's College Hospital in UK, Clinical Scholar, Harvard Medical School, Council Member of Roy SOCMED, Member of American College of Healthcare Executive. He is one of the eminent researchers in the IVF and reproductive medicine, and his presentation will be about breast cancer and IVF. Okay, please.
Hello, everyone, and thank you, first of all, to the organizers for giving me the opportunity to give a lecture today, and thank you all of you for attending. So I've actually been asked to give a talk about infertility treatment and breast cancer, and I've titled this talk Myth and Reality, so that we can discuss in a bit more detail about the perception of infertility treatment and breast cancer, but most importantly, the reality of the evidence behind this myth. So the title of my talk is actually appropriately titled The Use of Clomiphene Citrate and Gonadotropin and the Risk of Breast Cancer with these medication. This study was done at King's Fertility in collaboration with King's College London. So we've heard before, like by the latest Cochrane evidence about the risk of cancers such as ovarian cancers and endometrial cancer with the use of ovarian stimulation agents. And breast cancer is actually the last cancer as part of that trilogy of women's cancer. And what we looked at was actually a review of the evidence out there in order to understand if there is a causative link, and if so, what needs to be done. And if there isn't one, just to reassure everyone in terms of the usage of these medication. In terms of disclosures, I do not have any conflicts of interest to declare. This research did not receive any funding or grants from any agencies in the public, commercial, or not-for-profit sectors, and nothing to declare here. Now, ovarian stimulating agents and breast cancer. Now, when a woman undertakes fertility treatment, as we all know, commonly used ovarian stimulating agents are usually in the form of selective estrogen receptor modulators, such as clomiphene citrate and gonadotropin. Now, these can be administered on its own, or they can be administered in combination with each other, usually during the follicular phase of menstrual cycle of an assisted reproductive treatment. Now, why is this important? It is important because, first of all, breast cancer is very topical, and but more than that, it is actually the most common malignancy in the world. It affects around 1 in 8 women worldwide, and that's an absolute risk. We're going to talk in a bit more detail about what that means. But within our field, the reason why that's important is because with an increasing number of women seeking of IVF treatment or assisted reproductive treatment in order to conceive, you will be exposed to a significant number of women who are actually age in itself put them at an increased risk of both of them. And therefore, understanding the causative link between any of the medication that we give and the risk of breast cancer is of high clinical significance. Now, I was talking about absolute risk earlier, and this absolute risk is 1 in 8. And however, we do know that most women diagnosed with breast cancer are aged above the age of 50, but younger women do get it. And we've all seen patients who are coming to us with having been diagnosed with breast cancer and are coming to us for whether it's a fertility preservation program to collect the eggs, or patients who've suffered from breast cancer in the past and now are going through fertility treatment for whatever reason. Whereas commonly we do have women above the age of 50 having it. Like I said, women below this age certainly do have it. And I hope that you are all in agreement with me that no one is actually offering fertility treatment to anyone above the age of 50, because that would significantly put that woman at increased risk of any breast cancer anyway. Now, the reason why that's important is actually it's something that's actually very topical for patients, and we do all have patients who come to clinic with us inquiring about how safe the treatment is, whether it's associated with any link to any conditions in the offspring, but more importantly, in terms of whether that's going to affect their health. And the reason why breast cancer is quite important because it has a direct effect on the women, obviously. Now, just to take a few steps back in order to understand breast cancer. Now, breast cancer they are either termed as carcinomas. Those are tumors that usually start in the epithelial cells around in the breast, or they can be termed as an adenocarcinoma, and that's usually a form of invasion of malignancy that starts in cells around ducts, such as the milk ducts. Now, if the breast cancer is localized to the area itself, it's known as an in situ. That can be a ductal carcinoma in situ, for example, where the cancer is actually starting around the milk duct and has not grown or invaded to any other area within the breast tissue itself. Or it can be termed as an invasive breast cancer, which is whereby the cancer has spread to the surrounding tissues. The physiology of breast cancer is further determined by the receptor that it has. Being a hormonally sensitive cancer, it can either be sensitive to estrogen, whereby it's the estrogen receptor positive, what that means is the cells of this type of cancer grow in response to estrogen hormone. Or it can be a progesterone receptor positive, whereby the cells grow in response, it's sensitive to progesterone hormone, and then grow in response to that hormone. Or you have another variant whereby actually the cells actually do not have any hormone receptors at all, and they're actually unaffected by the endocrine physiology or the endocrine environment of the woman. Now, again, it's important because understanding the risk associated with various women at various age groups and various demographics allows us to risk stratify our patients and allow us to provide the right advice to these women. And also, more importantly, from a clinical point of view, it allows us to understand the individualized risk associated with individual patients having treatment, breast cancer being one of them, if there is a link at all. Now, as we've just said, breast cancer grew in response to estrogen level rising. And what do we do in fertility treatment? It's exactly what we do. So we give agents in the form of FSH or clomiphene, and what they're designed to do is cause an endogenous rise in the level of estrogen around the body. And if you have breast cancer or breast tissue that's sensitive to this hormone, it can lead to a change in physiology of the cells and make them cancerous. And to put that in perspective, the physiological effect of a woman having FSH or clomiphene, or mostly FSH in an ovarian stimulation protocol, has been reported to be equivalent to around 2 years of menstrual cycle in that period. So that is in terms of follicular count achieved and also the level of estrogen that's risen. With this rise, it's understandable that their effect on hormone-sensitive issues is of high clinical concerns. Now, why is fertility and breast cancer, why are they linked and why are they important? It's actually linked because one of the risk factors for breast cancer is nulliparity, and the other one is a prolonged exposure to either estrogen or progesterone. And we know that breast cancer has other various risk factors, but these particular risk factors is actually our patient demographics. People come to us because they've not achieved a pregnancy. And what do? We're about to expose them to prolonged exposure to estrogen and progesterone, and understanding how this can potentiate the activation of precursor cells in breast cancer, in breast tissue is important. And we've already talked about how important that is. So I'm going to skip this slide here. So what did we do? Now, what we decided to do is actually review the current literature around in order to assess the evidence of association between ovarian stimulation agent and breast cancer in infertile women. Now, over the past decade, there's been numerous studies looking at the association between these two, but they've actually been individually inconclusive or actually provided conflicting evidence. And what we're hoping to do in this program is actually look at every single evidence that's been published out there to see if there's actually a causative link between stimulation agents and the associated rise in exogenous and endogenous hormones, and whether that cause an increase in breast cancer. So how did we design our study? We actually included any individual studies that compare the risk of breast cancer among women having either gonadotropin, clomiphene citrate, or the combination of those within an IVF or ART program. Our participants of interest were women without any previous history of breast cancer, or women without any pre-existing cancer at all, because we know that having an existing malignancy already puts you at increased risk of other malignancies. So we actually excluded these women from our study. The type of intervention was the use of gonadotropin or clomiphene citrate on their own, or the combination of them. And it was quite important to define what the control group would be, because we know that infertility itself can be a risk factor to breast cancer. So we actually defined two control groups. So the non-exposed control group consisted of women who were not exposed to ovarian stimulation agents. These included women that were either infertile but did not undergo any form of a treatment, so they never undergone any form of IVF treatment or ART, and they were followed up and see if infertility itself was associated with that, or women of the general population who are not having any fertility issues at all. So we actually had two control arms within our analyses here. So our outcome of interest were actually the incidence of new breast cancer. So from a total of 4,148 abstracts that were yielded by our search algorithm, 4,104 were excluded for various reasons. And whether it was the abstract that was not correct, the title was not correct, or whatever, or the duplicate studies, etc., we finally concluded to 44 studies that were reviewed through a full text methodology. And out of those, 20 studies were finally included in the qualitative and quantitative synthesis of this study here. And this included 9 retrospective, 5 prospective studies, 5 case controlled, and 1 comparative studies. The 20 studies that were included contained data from 1.7 to 1.8 million cycles around the world, and it included studies from 15 countries, making this paper very global and very relevant to everyone. And also it included countries that were defined as high income and low income, therefore taking away the income bias of treatment that's being offered. Now, the way we define our results was whether clomiphene citrate was used on its own, gonadotropin was used on its own, or the combination of both, as we've said. It was quite important to demarcate an appropriate follow-up period for that, and the average follow-up for all our included studies was around 27 years, which is quite lengthy in our opinion, so that allows the results to be further validated from a time-lapse point of view. Now, looking at clomiphene citrate and breast cancer, and this is quite a busy slide, but just to explain to you, looking at the first plot here, you can see the 2 control groups that I was telling you about, the general population being the first half of this first plot, and the infertile population being the second half. A total of 19 studies were included in this analysis here. Purely splitting this first plot into the 2 groups now, in the general population, you had 10 studies that were included that reviewed around 1.5 million women. And again, you can, reassuringly, what you can see is the odds ratio was 1.03, which is great, which further reassures that the use of such medication was not associated with an increased risk of breast cancer. Now moving on to the infertile group, where you can see again an odds ratio of 1.04 was depicted here, which again further reassures that there was no increased risk of breast cancer with the use of this medication. And now we further we went a bit further step forward in terms of trying to differentiate whether the dosing of this medication had an effect. In the UK, we tend to limit the use of clomiphene citrate for anovulatory cycle by 3 to 6, so nothing more than 6 cycles, but I know around the world people do give that more. And there were only 3 studies that we could find that looked at that. And one study suggested an increased risk, whereas the other 2 didn't. But we decided not to include this in our actual manuscript because of the massive confidence intervals associated with these studies, so which makes not that significant. And what about the use of gonadotrophin in breast cancer? And again, you can see the forest plot, a very similar forest plot to the one I spoke to you before. Here you have 14 studies comparing the general population to the infertile population here. And what you can see is one of the studies showed the RENSCAD study here within the general population shows a little bit of an increased risk in breast cancer with an odds ratio of 1.52. And while it's overall, you can see that the odds ratio was 1.07, thereby depicting an overall reassuring effect in terms of the use of gonadotropin with breast cancer. We decided to look into the individual studies that reported a higher risk of breast cancer in order to fully understand the results, and I'll go in a bit more details in these particular studies in a bit more in a little while. Now, looking at gonadotrophins and the unexposed in the general population, you can see the odds ratio is 1.07 again, which reassures us that there's no significant increased risk of breast cancer. And again, looking at the infertile population, you can see again a very similar odds ratio of 1.07. Thereby confirming that, again, there's no significant increased risk of breast cancer in the use of such agents. Just like with the clomiphene citrate, we decided to go by dosage analysis, doing a subgroup analysis for that. And it was quite difficult to differentiate, to define what dose was around the world. So we do usually define them by units, other places define them by ampules. There were actually only 2 studies that reported on the number of ampules that we use, less than 25, between 25 and 65, and above 65. We did a log risk ratio analysis for that, and again, the risk ratio was 0.02, which essentially means there's no increased risk of breast cancer, and it was not statistically significant. What about the combined risk of these medication? And again, looking at the 2 separate control groups here, you can see that the odds ratio was approaching 1 at 0.92, which is further reassuring and therefore depicts no increased risk of breast cancer in the use of these medication in together. And I'm just, again, this is just a splitting of those versus general population and the infertile population. And you can see again, there's no increased risk of breast cancer in the use of such medication, whether it's used in general population or patients with a background of infertility anyway. Now, that's great, but also what we know is that the current study suggests that there's no significant increased risk in the usage of ovarian stimulation agents such as CC and gonadotropin. But, like with any studies, there are limitations, and it's important to recognize those and address those. One of the most common thing is, one of the most obvious one is this study is limited to observational, non-randomized controlled trials, and therefore at risk of intra-study and across-study biases. But you will not have an RCT anyway that will look at that, so you're very much restricted to this form of study designs when you're looking at risk of incidence of breast cancer or any form of disease for that matter. The usage of clomiphene citrate was considered to be used for anovulatory cycle. This was not always defined in every single study, but the single usage would allow us to presume that this was used within an anovulatory treatment. And again, there was a general lack of adjustment for confounders such as extreme obesity. However, other confounders were accounted for that included weight, race parity, age at first, age, menarche, etc. And there was no increased risk associated with these parameters, and those were addressed for in the initial analyses that I shared with you. What about the studies that actually showed an increased risk? What does that mean? You had 3 studies within the clomiphene use, 1 study within the gonadotropin use, and another one within the combined use. And we reached out to the authors, and in order to understand what the reason for that was. And actually, one of the main reasons was actually the gene campo BMI for one of them. And one of the other things was the women recruited in the rate status study were actually very young, and the follow-up period was quite short. So they actually didn't actually follow up the women for a long period of time to see whether it was significant from that point of view. And the Terry et al. Study, which is one of the other studies, actually says that there's actually a misclassification of infertility as a diagnosis, being self-reported study. And again, follow-up period in those studies were limited as well. In summary, this study reports data from nearly 2 million women around the world, and it is the largest evaluation study ever published. And looking at the use of stimulating agents, and we did not find any positive association between the usage and the risk of developing breast cancer. In conclusion, we hope that you are reassured, and you can further reassure the women that you take care of, and reassuring them that their usage did not put them at an increased risk of breast cancer. So as well, thank you for listening to me, and again, thank you to the organizers for giving me the opportunity to talk about this study today. And if there's any questions, I'll be more than happy for you guys to email me so that I can address them accordingly. Thank you.